Friends Life Care is partnering with Delcrest Medical Services and TENA to offer a personal care solutions program. Today, I have the pleasure to introduce Marie McCormick. Marie is a certified wound care nurse advisor with Essity Health and Hygiene National Clinical Team. Marie works closely with individuals and also care communities to assist with developing, maintaining, and strengthening continency care. She's a liaison for addressing questions to incontinence needs and promoting skin health. Marie's primary goal is to assist with achieving the highest quality of dignity, comfort, and health for all customers. Marie's diverse nursing background includes consultation for those living in long-term care, skilled, memory care, rehab, and acute care communities. She has also worked in hospital orthopedic and cardiac care, labor and delivery, maternal child health, school nursing, and community education. Marie has held multiple roles with Essity, TENA for over 18 years and leads with education and supporting individuals and caregivers. Welcome, Marie.
Oh, Kiersten, thank you so much. That was a very kind introduction. I'm really glad to be here with you today. Thanks for including me.
We're glad you're here. One of the things our care coordinators get frequently asked about is urinary incontinence. Can you explain what that is?
Oh, sure. You're right. That's a very common concern that comes up. And the term incontinence actually just means that there's an involuntary loss of urine. And that can be anything from a light dribbling that only occasionally happens, or it can be a sudden big gush of urine, or continually just not being able to hold your urine at different times throughout the day or night. And this can occur really at any age and in any lifestyle, and it occurs with both men and women.
Are there different kinds of incontinence? Does everybody experience this the same way?
Wow, that's a good question, because actually there are different types of incontinence. The most common is probably the one that's called urge or an overactive bladder. And that creates a very strong, often sudden and need to void very quickly. This may occur more frequently than you normally would need to typically be going to the bathroom. And the muscles of the bladder are involuntarily contracting, creating that abrupt need to go. But another type of incontinence is called stress incontinence. And that's probably one that every one of us has experienced at some time in our life. And this happens usually when we laugh or cough or sneeze. And when we do that, it increases the force of the muscles in our abdominal area, which presses then down on the bladder, causing an abrupt, release of urine involuntarily. There's also something called overflow incontinence, and that is when perhaps there's an overfilling of the bladder and it starts to basically overflow and we can't hold it anymore. Or we have voided, which is another term for urination, but we haven't completely emptied our bladder. So it continues to seem like we have leakages of urine either immediately after that or throughout the day. There can be a combination of any of those types of incontinence, and that's referred to as mixed incontinence. And another one that's really common is called functional. And functional just means that we do know we need to go to the bathroom and to urinate. We just can't get there in time. And that might be related to our ability or our inability to move around, the distance it takes to get to a bathroom. Maybe there's furnitures or obstacles in the way of getting there. There can be confusion or even a loss of memory about where and how to get to the bathroom. Perhaps somebody has been having some forgetful moments. And it can also be related to physical limitations. Maybe you've had a recent surgery or injury and you just can't get to the bathroom fast enough.
Mm-hmm. That's great. I only thought of overactive bladder, since you hear that on the TV a lot, or the stress incontinence, because it's mostly targeted towards women. Can men experience stress incontinence too?
Oh, absolutely. As it's just related to having a sudden increase of abdominal pressure, usually because we're having a good time and laughing, or, we have that sudden cough or sneeze and our bladder was full. And because of that pressure, it pushes down and creates a leakage. For some people, because of weakened muscles around the bladder, it can happen more frequently. So for somebody, it might be a rare occurrence, and for others, it starts to become bothersome because it happens all the time when they want to laugh or they have a cough.
Sure. Thanks for clarifying. What are some other reasons someone would experience these types of urinary incontinence?
Well, there can be many causes of urinary incontinence, and often the onset can also be related to a medical situation that the individual could be going through or have already experienced. Something like a stroke, a heart attack, circulatory or neurological problems, and memory-related decline. All of those medical situations could result in episodes of loss of urine, a loss of sensation, a loss of awareness that they need to get to the bathroom. And sometimes just our perception becomes dull or not perceived. And sometimes the message from the bladder to the brain and then back from the brain to our muscles is slowed down a bit as we age too. Other conditions medically, like diabetes is an example, create a situation where our body actually makes a higher volume of urine. And then when we need to urinate, it is a very strong urgency, possibly with very little warning that they need to get to the bathroom. And other types of medical situations could include something like an obstruction caused perhaps by a tumor, a blockage due to even a BM or feces in the constipation, if that's a problem. And for our men, an enlarged prostate can create problems with urination.
Mm-hmm.
There can also be perhaps a concern about having an infection. Maybe there is a urinary tract infection or a bladder infection. And when there's bacteria in the urine, it can cause the muscles to be more irritated. And that can result in a more overactive response or a feeling that you just need to go continuously. With women, we have another situation where our hormonal changes occur as our estrogen levels drop. That causes a thinning of the lining of the skin around both the urethra, which is the passage for the urine, and around the vaginal area. So we do lose a sensation sometimes about needing to urinate. And when we've been childbearing women, then those muscles of our pelvic floor are weakened. And that can result in less ability of the bladder to be able to hold for longer periods. Along with medical conditions, you can be taking medications. Some medications inherently have have side effects with them that are resulting in higher volumes of output and a stronger urge or frequency to urinate. And many times it means that you're also taking multiple medications, and the combinations required to take care of your own health needs can sometimes have side effects such as that, and the ability to react to the need to urinate. Probably the most common, though, too, is the most common factor would be a decreased or limited mobility, difficulty walking, maybe having had injury or surgery recently. Along with, one thing we don't think about is diminished eyesight. So if we're having trouble visually, we may not see obstacles in our way, and that can prevent us from getting to the bathroom in time.
Sure. So there's lots of different reasons why somebody can experience this. There's lots of different types of incontinence. What can be done about incontinence and controlling it?
Well, good point. The first and foremost, it would be important to share your information with your medical or healthcare provider. You want to discuss with your doctor, your care coordinator, or your nurse practitioner. Explain what you're experiencing, and don't be embarrassed by it. It's important to have a good communication and dialogue, because there are studies or tests, a urinalysis, a bladder scan, an ultrasound, and some other studies that can be done to see what is causing the incontinence, perhaps, as well as what solutions might be out there medically to help resolve and control the problem. So your healthcare provider would work with you individually to determine what's needed based on your health history and how to best either restore normal function or improve the situation.
That's great. In addition to our healthcare providers, our medical team, are there things that we can do ourselves to manage incontinence?
Oh, good question. Absolutely. And I would start by suggesting keep a log or a diary and write down what are you experiencing with the incontinence? When is it happening for you during the day or is it at night? How did you feel during that episode? Did you feel like you were voiding heavily? Was it light dribbling? Did you not even feel it at all and then just felt like you had urinated and your clothing was wet? Did you feel like your bladder emptied completely? Or do you still feel after voiding that you have to go some more? Are you waking up at night? How often do you wake up at night? Those are questions that help your medical professional pinpoint down what's causing. So anything about what was going on can help pinpoint the causes. And then in your own home, as we said, look around for obstacles that might create a barrier for actually getting into the bathroom.
Yeah, that's a great tip. If somebody is worried about incontinence or maybe experiencing incontinence, should they ever cut back on drinking water?
Well, that might seem like a way to handle it, but actually, we want to really encourage good hydration and drinking water throughout the day. Drinking water is important for overall health, and that includes your urinary and bladder health. So, actually, making sure we have water throughout the day is very important. If there's concerns about nighttime incontinence, taper down the fluids throughout the evening, slowing down the consumption perhaps after 4 or 5 o'clock in the evening, having smaller amounts. And then throughout the day, try to avoid beverages that have caffeine or sugar or beverages like soda because they have irritants that can irritate the bladder wall and create more of a stronger urge to have to void very suddenly.
Good to know. As I mentioned earlier on TV, we see advertisements for pharmacological ways to manage overactive bladder or OAB, but we also see lots of advertisements targeted towards the products to use for
Mhm.
incontinence. Is that something that somebody should consider using, a product to help keep them dry?
Well, that's a good point because one thing we want to ensure that even when you're waiting for your medical physician to help you with a diagnosis and a treatment, we want the individual to always be able to stay dry, be comfortable, be odor free, and have the ability to continue all the activities that they enjoy without being worried about having incontinent episodes and having anyone else realize that. So there are many, many products that are on the market that can help contain urine. However, often the choices that are found in your local, like corner drugstore, the grocery store, or a big box store or a Walmart, you go down that aisle and it's just so many choices, but they tend to be geared for very low level incontinence, which is basically, just light dribbling or minimal. And that may not meet the needs of a lot of people related to what they're experiencing. And some of these products that people choose are actually geared for feminine hygiene. And those types of products do not absorb urine well. So they should be avoided when being purchased.
That's great. When you talk about the products, can you be a little bit more specific on what products you're referring to for incontinence care needs?
Yeah, there's many different choices that the options can include like an insert pad, light pad, and they range in size. They would be placed inside of your own, washable underwear. And these would be for light episodes or dribbling. There's also men's guards that are available to help with male incontinence. There's disposable pull-ups and that type of underwear can be for light to moderate amounts. and disposable briefs for heavier urine incontinence or when there's bowel incontinence. Pull-ups and pads frequently don't contain bowel incontinence very well. So a heavier brief would contain it most appropriately. And it's important to choose the product that's going to meet the level of your incontinent needs, as well as the right sized products.
Exactly. How do these products work to help with incontinence?
So the product itself catches the urine, wicking it away from the body, capturing it into the absorbent material that's built into the body of the brief or pull-up or pad that's next to the individual's groin. The materials inside an incontinent product are generally a paper pulp material, and they contain an absorbent polymer. There are different levels of these materials and different levels of the polymer based on the type of product that's chosen and the manufacturer that's making them. Quality products tend to have a higher level of absorbent polymer in order to be able to absorb a greater amount with less just paper fluff, which can make it bulky and uncomfortable to wear. So we're looking for something that's a little bit more discreet, would be more preferable. Another key is to look at the components that make up the outside of the product and how it is made, because if a product has a plastic or rubber-based backing, that actually traps heat against the body, and that can create sweating, skin breakdown, irritation, or itching, and those products should be avoided instead. So a material, although it's made out of a primary paper product, should have more of a cloth or soft-like feel, preferably be a product that was made to be breathable. And a breathable product is one that allows heat and humidity to escape through the product, but it still captures all the moisture from molecules from the urine, and the better products also eliminate odor associated with urine. So it should not be apparent to anyone that you're wearing a product.
Right. Lots of things to think about when it comes to selection. You mentioned skin irritation. Is
Mhm.
that common with incontinence, and what might be some ways to prevent it?
Yeah, we want to avoid having any skin breakdown for anyone because there are irritants associated with urine and bowel against the skin. So the most important thing is to pick the right level absorbency and the right size, and that will help to prevent leakages. Skin hygiene itself is very important since, as we mentioned, urine and bowel can be irritating against the skin. However, frequent washing with just soap and water can also overdry skin and cause cracking or additional irritation. So you want to make sure if you're using a soap product, it's mild, skin friendly, and that you're rinsing it well. There's also creams that are now available that are a no rinse type product. They're applied on and it's a cream type of soap and a moisturizer all in one step, which is a very convenient way of doing that. If you're using a cloth washcloth to cleanse yourself, it always should be dampened because a dry cloth would be irritating against the skin, and we should not be using something rough like a paper towel for cleansing. There are disposable wipes available on the market, and they should be free of extra irritants. I would avoid ones that are highly perfumed. That can create some additional irritation of the skin. And even if you buy one that says flushable, read the instructions on that package. Generally, it's one wipe per flush. But overall, get into the habit if you're buying a disposable wipe or washcloth that's disposable, throw it into the wastebasket receptacle instead of down a toilet, because there are problems with septic tanks or plumbing systems, and we wouldn't want that to be another problem to deal with.
Sure. It's a great reminder. So, with all of this that we've been educated on with products and skin protectants and disposable versus flushable wipes. It sounds like it could be really confusing to somebody standing in an aisle to select the product in the store.
Yeah, I think sometimes the choices just seem overwhelming, and both the individual or the family member may not be sure which of those products will hold enough or be the correct fit. And when you're standing in that aisle and it's just one colored package after another, it's very confusing. And they might be confused about what to buy, what level to purchase, and they can be kind of self-conscious about asking a salesperson, or embarrassed if they see their neighbors finding them in that aisle too. And we don't want that discomfort. So I think that's one of the reasons why I really like the program that you've developed at Friends Life Care Partners, because it works so well with assisting your clients individually and with a confidential conversation and with their family members, so that you can help guide them with what they're doing and what they need.
Right. We've gotten such great feedback on our personal care solutions program. This is the partnership with Delcrest Medical, and it's intended to help address the concerns of our members, their family, and the caregivers that they work with. Our partnership with Delcrest and Tenna is meant to simplify the selection process, exactly what you just said. They have access, our members have access to dedicated staff trained in continence education, sizing, and product assistance. Our goal is to help our members to achieve peace of mind, and that's thanks to this partnership with Delcrest and Tenna.
Well, I just think it's fantastic. I don't find a lot of organizations thinking this far ahead about their customer needs, and I feel privileged to partner with you because we all agree on those goals, that we need to provide solutions so that everyone can maintain their lifestyle, which should be free from worry or from embarrassment about any leakages onto clothing or furniture. We want to help prevent odors and help to keep their skin healthy. So with the support of your care coordinators, the clients can also, as you mentioned, at no cost, have a private consultation by phone with one of our Tenna nurses and talk to us freely with, about anything related to their incontinence needs. We can help them with thinking about products that may assist them. And we also, through Delcrest, they are able to get samples of products to try, to make sure that they're actually going to fit well and perform what they need prior to having to do any purchasing. So that's kind of a relief too. You're not just spending money until you know that it's something that's going to be what meets your needs. So I just am really proud to be able to be associated with you, because you are working to help reduce the challenges that families and individuals find about going to a store and getting products.
Thank you. And we're so thrilled that you're a part of this program as well. For our members who could be watching this, if you are interested in learning more about the Delcrest Personal Care Solutions Program, please contact your care coordinator for more information. Thank you so much, Marie.
Thanks. It was great seeing you again. Take care, everyone.
Bye-bye.